Welcome to our 2017 Parents and the High Cost of Childcare webinar. My name is Lynette Fraga, and I'm the Executive Director at Child Care Aware of America. We're so glad you could join us, and thank you for taking the time out of your schedules to discuss the findings in the 11th edition of the Parents and the High Cost of Childcare. We are recording this webinar, so those of you who want to review a portion of it or share it with colleagues who were not able to attend in real time can still hear the webinar. You can also visit our website at usa.childcareaware.org to see the interactive state map, download additional resources, and read the full report and appendices. We're excited to highlight some new features in this year's report, including county-level costs for 7 states, along with expanded reporting on the average cost of summer-based care. Today you'll be hearing from our research team led by Dr. Dion Dobbins and Jess Tersha to examine the cost and affordability of child care across the country. We'll also hear briefly from a family struggling with the cost of care and then hear comments from Senator Patty Murray of Washington State before taking some time out to answer your questions. If you do have a question at any point during the webinar, please enter it into the chat box. We'll be addressing questions during the Q&A portion at the end of the webinar after Senator Murray gives her remarks. If you have a state-specific question, please connect with us after the webinar. We will provide that contact information on a slide towards the end. And now I'll turn it over to Dion and Jess for the report overview and key findings for 2017.
Great. So thank you so much for being on this webinar with us today. This is our 11th report, and it's our 30th anniversary. This year's report, you'll see as you look through it, we really slimmed it down. We're focused on the cost of care this report, and we're looking forward to keeping the conversation going throughout the year. As you know, working families across the country are basically struggling to afford quality child care. So our report, as it has in the past, summarizes child care costs and affordability across the United States. We talk about child care being a sound return on our investment, and we then review some policy recommendations and financing solutions. We'll be releasing reports throughout the year that are focused on special populations, such as infants and toddlers, families and children with special needs, issues around health equity, all about how they relate to child care and costs and the folks that take care of our children, child care workers. You'll see if you go to our website, you'll see a number of different things. We have included, of course, the report itself. Then we have all of the appendices that go with the report. We have our updated interactive map that has complete with print-friendly PDFs, so you can take your state's data with you. And as we mentioned earlier, there are 7 states in which we have county-level costs. We've included a parent tip sheet, which is really helpful for folks who are trying to understand what they can do at the individual level. We have social media information, social media share kit that hopefully you can help us get that information out. And in January, we'll release a county-level supplement that really digs deep and explains what we found at the county level with regard to cost. Okay. I know I'm preaching to the choir here, but we think of child care as a workforce support, and it really provides a great return on our investment. We know nationwide that when families do not have access to quality, affordable child care, they're losing about $30 billion a year in wages, and it's due a lot to the fact that they can't find accessible quality, affordable child care. We also know that American businesses lose more than $4 billion a year due to their gaps in child care and breakdowns. For communities and businesses, high quality and affordable child care is a smart investment. It supports the workforce of today, that's our parents, while helping to lay the strong foundation for our future workforce, those are our kids. And it has a tremendous impact on our families, on business, and those at the state and federal level economies. When parents can afford quality and safe places for their children during the day, they're more productive. They're not worried about what their children are doing, and more money is poured into the economy. When they're supported with family-friendly policies, flexible options, and assistance from employers, they feel better about leaving their kids. They're less likely to be absent, more likely to stay in the same place and feel rewarded. Listen, when we win, we all win when quality child care is affordable. We also know that states and communities are digging into this piece about return on investment. They're really trying to get a sense of what happens when working families don't have access to child care and what happens to the economy. So, for example, we love to highlight Louisiana's report, Losing Ground, where they noted the enormous impact felt across the state by families as well as businesses when they do not have affordable child care. And every parent has had this happen when your child is sick and you can't go to work, but also when your provider is sick or needs to close and you can't go to work. There are things that happen and they're felt throughout the economy. Many families can't afford a 5-day per week of child care, and many are cobbling together child care situations to make it work. So if one link breaks down, families are left in a lurch, and businesses don't have workers, and the entire economy suffers. So we're going to get right into the business. So before we talk about some of the data, I wanted to give you a sense of how we collect our data. So in February 2017, we surveyed child care resource referrals, state offices, and state network offices, and local CCR&Rs to get information about 2016 cost data. We collected data on the average prices that parents pay for infants, which we define as 0 to 12, toddlers, which is 13 to 36 months, and 4-year-old children, and school-age children, which starts at age 5. We're looking at families that are accessing care that is legally operating child care centers and family child care homes. And by legally operating programs, we're including licensed programs and child care programs that are illegally exempt from licensing, as long as they're monitored. So our data contacts recorded this data based on either their market rate surveys or the databases that they maintain. It's important to note that this report does not describe child care that's provided by a relative or a nanny or someone in the informal care system, like a neighbor or a friend or a family. Just so you know, when we talk about the work that we're talking about both the cost or the price that parents are asked to pay and the affordability. So the affordability is the average cost of care in a state as it relates to the state median income. So keep in mind that least affordable does not mean that it's the most expensive. It's basically the cost of care as a percentage of an income that's highest when it's compared to all states. When you look at our tables, you'll see that we use both not only the information that we collected from our CCR&Rs and our government agencies who collected the data on child care costs, but we also use publicly available or accessible data from the United States Census Bureau and the United States Bureau of Labor Statistics. And we provide rankings on a number of different issues, specifically on affordability by state. In the appendices, you'll see information on costs, affordability for married couples and single parents. You'll see it for varying poverty levels, and we also do some work around affordability for child care workers. Also, just as a note, there are some states that did not report data. Alabama, Mississippi, Pennsylvania, and Rhode Island did not report data, and so for those states, we adjusted the cost that we had from last year for inflation. Colorado and New Jersey collect data that is not comparable to the other states, and so you'll see how we dealt with that in terms of like the ranking. And 10 states were not able to break out costs for the difference between infants and toddlers. In the past, we rolled up that data to look at infants and toddlers, but this year we separated it out. And all rankings are in the appendices. Okay, so I'm going to share some of the key findings. And again, we really encourage you to look through the report. There's a lot of data, but some of the things that we wanted to share with you in general. I mean, when we look at our data, particularly when we look at married families in center-based care, child care is unaffordable for all families across the country. In our report, you'll find the top 10 rankings for each group by affordability for married couples for average center-based and family child care costs. In Massachusetts, we consider that the least affordable state for families are infants and or toddlers in center-based care. And New York is the least affordable state for families with a 4-year-old in center-based care. Remember, each state has a unique child care landscape, and some states have enormous center-based care, child care footprint, while others have a more rural landscape, and the rural states often depend a lot on networks of family child care providers. So the example we like to share is Minnesota. Every year they're ranked pretty high as one of the least affordable child care places for center-based child care for an infant. However, if you look at the ranking for family child care, you'll see that they are listed as one of the 15 most affordable. So most of their child care in the state is family child care. So it's really important that you understand what's happening in the state and understand the footprint for either family child care or center-based. So please, when you look at this, consider your state's unique child care landscape and what costs might mean for families in your state. And remember, all costs that we report are reported in a number of different ways in the appendices, and you can download that all from our cost of care site. A couple of more key things that we've talked about. Similar to previous years, child care is the most major household expense. It outpaces the average cost of transportation and food in every region in the United States. In addition, child care costs frequently rival or outpace the cost of housing. Center-based costs for an infant outpaces housing in 35 states, plus the District of Columbia. Center-based child care costs for infants outpace the cost of tuition and fees in college for a public college in 28 states and the District of Columbia. And for center-based 4-year-old child care, costs outpace tuition in 15 states, plus the District of Columbia. And then when you talk about recent or not so recent grads, the annual cost of child care is a double whammy because they just simply can't afford it. This is a great place for me to put a plug in for our millennial map, where we look at families who are headed by millennials, and many of them are in school. So take a look at that. That will be updated this year as well. And finally, I want to talk a little bit about, in general, the fact that you'll look at our statistics and you'll see that low-income families are hit hard by unaffordable child care, particularly when you look at child care workers. Too many of our child care workers are living in poverty, and last year the median wage for child care workers in the United States was about $10.18. So these workers are making about as much as someone in the fast food industry. And so they're also less likely to receive work-based benefits like health care and have difficulty making ends meet. And many, in fact, are unable to afford child care for their own family. And according to our calculations, in every state, child care workers would need to spend more than half of their income in order to afford center-based child care to families. So let's put a face on some of this data. I'm giving you all these data points, lots of infographics, interesting data. I want to introduce you to Nicole Neal. She's a parent advocate and educator. She lives in Long Island and has struggled in the past with the cost of child care. I want to let her tell her story. Welcome, Nicole.
I think she's muted.
Nicole, are you muted? If you are, can you unmute? We can come back to Nicole. That's not a problem. I'm going to let Jeff share some of the statistics some additional statistics.
Sure.
And take us through our map, and then we'll come back and see if we can get a hold of Nicole.
That's okay. 1 second. There we go.
Hello?
Oh. Nicole.
Yay! Sorry. Thank you. I didn't understand why it wasn't working. All right. Hello?
Thank
Can
you
hear
so
me
much
now?
for joining us. We
Oh,
can
no
hear you
problem.
and look forward to hearing your story. Thanks.
Thank you so much for having me. Um, um, my name is Nicole. I am a mom of a beautiful 3-year-old boy. Like you said, the biggest struggle I think for young families, especially living on Long Island, is childcare costs. I know when we were living in Manhattan when I found out I was pregnant, and when I went to go look for child care providers, I mean, I had a good job teaching in Manhattan, and I would say probably 70% of my salary would have gone to daycare. So my husband and I made the decision that we would move out to the suburbs of Long Island, where maybe we could piece together family members, where my family lives out in the suburbs of Long Island, maybe try to figure something out between the cost of living of Manhattan and also the cost of childcare. We just decided we would move out to the suburbs. Unfortunately, the suburbs are not any better. The cost of childcare was so much so that I decided that I would not be going back to work. And as an educator myself, it broke my heart because my passion is education, and I had to put my career on hold. And I loved spending every moment that I could with my son, but I also loved my career. Even so that I tried working at a daycare facility just, to keep working. But what I found was that my whole paycheck would be going to care. It costs about maybe $25,000 a year to send a newborn to daycare out on Long Island. So pretty much the decision was easy. I stayed at home with my son. I think on Long Island specifically, the high cost of living paired with the cost that is made for parents to pay for childcare just makes it hard. I want to have a second child, and every day I have mixed emotions. I want to have another child, but can I afford to put my career on hold? Can I afford to put this child in care? I mean, we already pay for my 3-year-old. We have him in part-time care, and my dad, who is retired, he's the one that provides the gap care, the in-betweens when we can't be there. And if something happens to him, what are we going to do? And these are the struggles that I have, and I know that there are families out there that are struggling even more so than I am. So I guess I mean, like, I just don't think it should be this hard to raise a family, and it shouldn't be this hard to find care. As an educator, I know how important it is to have quality child care, especially in the early years when their brains are absorbing so much. It shouldn't be so expensive. It's such an important part of their lives, and you shouldn't have to sacrifice your job. You shouldn't have to sacrifice like putting them into a facility that maybe isn't licensed, that isn't the safest option. These are things that parents have to think about daily. You want to put your child somewhere safe. So I just don't, there shouldn't be this much stress involved in planning for a family. It's a lot. And having children is a joy. It shouldn't be this hard. So that's my story. Thank you so much for listening.
Yeah. Nicole, thank you so much for sharing your story with us today.
No problem. Thank you so much.
So after hearing that story, we're going to talk a little bit more about the cost of care across the country. As Nicole said, child care is so expensive. It's prohibitively expensive for a lot of families.
And one thing we wanted to dive into a little bit more this year was teasing out just how unaffordable childcare is nationwide. Each year, researchers and the media reach out for national average costs of childcare, and it's a number that we've been a little bit hesitant to nail down. And unfortunately, each year we see folks try to work it out for themselves. So this year, we wanted to tease apart a few potential methodologies to kind of get a feel for what this number could look like. While we still don't entirely recommend using just an overall average, largely because you use all of those unique qualities about childcare landscapes in states and in communities, we did want to get the conversation going around just how unaffordable childcare costs are. And again, as we keep saying over and over, childcare is unaffordable for families everywhere. So in doing so, we worked through a couple of methodologies. The first being an average of averages, and then an average weighted by the number of childcare slots by program type, and an average weighted by the number of programs by type, to kind of tease apart a couple of different methodologies. And I'm just going to talk through some of the differences that we found when working through like a national average for one of the methodology types. Across the board, averages ranged from around $7,500 a year per child for family child care to around $9,700 a year for center-based child care. Overall averages came to around $8,000 or $9,000 for a year of child care, but what does that really mean? So to lend a little bit more context around this, if we look at one of the methodologies, overall average, and then compare that to the median household income for a married couple, we come out to about 10% of their household income is going to pay, on average, the cost of one child in child care, which is a lot. 10% is a lot of your household income to pay. As we work through this and we drill down and work on those kind of unique differences, we look at the average overall across ages for center-based child care. We see that that percentage starts jumping a little bit higher to 11% of household income, or for single parents, it jumps up to about 39% of household income. So 36% of household income for a single parent to pay for child care was already high, but the number just keeps getting higher. And again, just drilling down a little deeper, once we look at a center-based average for an infant in child care, the affordability of that jumps up to 13%. So that's just a feel for how some of those unique issues around age and childcare situations start disappearing, but how we can have this kind of conversation about how nationwide families are struggling. So I'm very excited to share that our cost of childcare map on our website has been updated, and if we have time, we'll take a quick walk through that. But just so you can get a feel for how it looks, again, I can't stop saying it, childcare is unaffordable across the country. States are categorized by color, by affordability of center-based infant care. As a reminder, do check out our appendices for a full listing of average costs for center-based and family child care across age groups by state. And as an additional note, this map represents data which has been rounded to the nearest percentage point. So just a quick peek at some of the things that you'll find as you explore our map. Some of these features, and we'll just take a look at what you would see if you clicked on and explored Minnesota a little bit. You would find a pop-up of Minnesota with some of their numbers, as well as a print-friendly PDF of their updated data. And we just want to make it a little bit easier for folks to print out the information for just their state and take it with them. We're also really excited to announce that we, again, did some county-level mapping. Last year we did 4 states worth of county-level mapping, and this year we've added a couple more. So this year I'd invite you to explore the county-level maps for Alaska, Arizona, Delaware, Hawaii, Massachusetts, Minnesota, and New Hampshire. We say over and over again that each state is a unique child care landscape. And as we made an effort this year to report a higher level national picture, we're also continuing to dive deeper and explore those differences, particularly on a county level basis. Child care costs are dependent on so many factors: child care type, so if we're talking about center-based or family child care; quality level for states that are currently participating in a QRIS system; and especially where you live. We frequently get questions about why the statewide averages we report may be so different than what a family is paying for child care near their home. So these county-level analyses are just an initial look at how child care costs can differ across any given state. So with that, I'm going to take just a quick moment and pull up our map and give you a quick demonstration of it. Again, I'd invite everybody to go to our website when the webinar is over and explore the map a little bit more. So when you go to explore state-level data, one click will give you a pop-up where you can view all the data. Quick synopsis of what we just looked at. And if you want to, you can choose select a state to move to the next state. But honestly, that's not as much fun as going back to the map and finding the next state to explore. If you're interested in looking at county level data, you're going to double click on that state. I'm going to try that one more time. There we go, to get a county level breakdown of the data. And from there, the same thing. View all data, and you get a quick pop-up with the costs for that particular county. Click anywhere to go back to the map. There we go. And while you're checking out the map, make sure you scroll down and check out all of the other fun reports that we have up there. Of course, the full report, the appendices, our social media toolkit, and a parent tip sheet. Now I'll go back to the presentation and turn it back over to Dion.
Thanks so much, Jess. Really excited about the maps and all the PDFs, that are printable and user-friendly. We're really excited about that. A lot of times after we share this data, people often say to us, what do we do next? What's the solution? And I can say that many of the solutions, especially the ones that are most innovative, are happening at the state and local level. So we'll share those with you as well. But also wanted to make sure that you take a look at the parent tip sheet if you're looking at what you as an individual parent or a person can do. That tip sheet shares information about like how the child care resource and referral community can help you find quality, affordable child care and see if you're eligible for different types of programs. But at the state and community level, we talk about a lot of financing solutions that states are doing to make child care more affordable for families and to support child care providers to have quality child care for working families. The first thing we talk about is making sure that states really have a good understanding about what the cost of providing child care is and the cost of providing quality child care and building incentives in that cost so that programs can meet higher standards and states can incentivize programs to do that. So in order to really understand the true impact of cost, it's important to not only know what parents are charged, which is kind of what we talk about, but understand the gap between what parents pay and what the true cost is of programming. And there are a number of online tools to help states estimate that cost of quality, and we talk about them in our report. And it's really also important for me to mention that with our mapping work, we are really going to be able to take deep dives into our state and look at into our states that we're working with to understand the specific child care landscapes and understand why gaps exist and really have a sense of the cost at the local level and maybe even looking at cost and quality. So look forward to those things as well. We have a number of different solutions that are about making sure that child care is seen as a business, that they're really thinking about how they can share the administrative costs of running the business and pooling resources and purchasing goods and services in bulk with other programs so that they're in a better position to leverage costs and have lower costs. We have some examples of those in our report from Ohio and New Hampshire, and foundations and funders are very fond of this model, and so that's something to think about. We also talk about making sure that states are financing quality and supporting quality initiatives so that they show up the quality of settings where we know children are being placed, particularly in family child care centers and areas where populations where we know where access is an issue. States and foundations are supporting initiatives like All of Our Kin, who are trying to work with family child care providers in Connecticut, and there's public-private partnerships in Oklahoma, where the state of Oklahoma is matching general funds with private dollars to provide technical assistance to ensure that we have quality child care settings. One example that I wanted to share with you this year is called Tiny Boots. It's a partnership between the YWCA and the Illinois Department of Veterans in Illinois. And what they've done is worked with veterans who are in need of child care when they're working on, when they're doing their medical or counseling appointments or they have job interviews. And what they're doing with this collaboration is providing child care to families during this time at no cost for the veteran. And the program, they worked closely with the lottery and a grant from the Illinois Department of Veterans Association cash grant program. So that's another opportunity that we wanted to highlight this year. Of course, we always talk about how we can work closely with the business community. Once we make the case that there is a business case for quality child care, working with the business community either as advocates or by working with them to provide TA or developing toolkits to help communities make the case for quality and affordable child care and promote family-friendly policies. We have some great examples in our report about that. Again, using the tax system in many different ways to support child care or to support early care and education through fees for services like the Philadelphia soda taxes, tax credits for business investments in child care like they do in Louisiana, making sure that parents receive refundable tax credits to defray the cost both at the federal and state level. And then finally, we're really excited and interested in learning more about what's going on with the social impact bonds that are supporting child care and social investment with a public benefit. The goal of these social impact bonds is to encourage local experimentation on novel ideas and then evaluate what works and fund what works and defund what is not working. We're anxiously awaiting the new report from the National Academies of Sciences that is due out in January, where they're going to be providing some guidance on what, from the national level, what we should be doing around financing early care and education and really focusing on having a highly qualified workforce. So we're really excited about that. And again, if you're looking at trying to figure out for the individual level what you could be doing, again, we really, we'll talk a little bit about this later, but Child Care Works is our advocacy movement, and you can be involved with that. And also, please check out our parent tip sheet. Now I'm going to turn it over to Lynette, who will then introduce our special guest speaker.
Okay, terrific. So first, thank you, Dion and Jeff, for sharing about the major components of our report, and completely appreciate the tools and resources that are available on our website, the full scope of the report that we are reviewing. All of that is tremendously useful and helpful. And I also want to share a word of appreciation to Nicole. Thank you so much, Nicole, for sharing your story, having the capacity and ability to really dig into what our families' everyday experiences are. Again, the comment that really resonated for me as you were speaking, Nicole, is this idea of, child care shouldn't be so expensive when you're trying to do the best that you can for your children and families. And also that the process that families go through are so incredibly stressful. It's a lot. And I hope, and we hope as a community of those that support families and children, that we do reach solutions for all families. As was shared by Dion and Jess, there is a lot of information in the report at the county, state, and national level that really describes and clearly demonstrates the high cost of care for families across the country. They need care in order to work and go to school, Children need a safe and nurturing place where they can learn and grow. And unfortunately, for far too many families, we do not have access to high quality care, and many families cannot afford it. It is one of the most significant expenses in a family's budget, and this often forces families to make such difficult decisions about investing in care or being employed. Working families pay more for child care than they would for their mortgage or their rent, their transportation, or food every month. In addition, the child care workforce itself faces barriers due to lack of a quality wage. Oftentimes, child care workers themselves can't access the quality care that they provide for other children. So what I believe, are going to do over the next several minutes or so as we are waiting for our special guest to arrive, we'd like to open it up for Q&A. If you have any questions, please don't hesitate to type them into the chat box, and we will field those questions over the next several minutes. Again, I would encourage you, if you are at a computer, to get online and begin looking at our resources and our tools. We are always open for suggestions as well. So if you have any suggestions about what tools, resources, or information that you would like to see from us, please don't hesitate to also share that with our team. Again, our contact information will be available at the end of the presentation. In addition, as Jess was moving through the state and county level mapping, I know that many of you were very eager to deep dive into your own geographies in your own states. If you do have state-based questions, please, again, as a reminder, don't hesitate to reach out and ensure that, that we can, as a team, respond to your questions. We're holding as we're moving through some of the questions to pose.
So there's a question up on in the chat box, and I'm going to ask Michelle McCready, our Chief for Policy and Research, to kick off this response. When you say you are investing in child care, are you referring to CCDBG, or the Child Care Development Block Grant?
Great question. Thank you so much. Hello, everyone. It's Michelle with Child Care Writers America. Great to have you on today. Thank you all so much for joining. So absolutely, that is one of the major investments that specifically Congress can make in funding the child care system is through the Child Care and Development Block Grant. But it definitely doesn't stop there. So when we're calling for policymakers to invest in child care, we're looking at policymakers at all levels of government, at the local level, at the state level, and at the and of course at the federal level. So both your members of Congress and senators, we are asking them to invest in CCDBG and other forms that support child care programs and the child care system. And a great way when you're working with members of Congress and all policymakers is to ask them, what is your child care plan? How are you investing policymaker X or Y at all levels of government in a plan that supports working families around affording quality child care? So that's a good question to always ask your policymaker.
Great. Thank you so much, Michelle. And we're pleased to see that questions are popping up, so we will take as many as we can. So the next question for my colleague Jessica is, where could we find the cost per state for rent, transportation, food, etc.?
Great question. So for rent and for mortgage costs annualized, we provide that in the appendices of our reports. You can find that there. I believe those come from the Bureau of Labor Statistics off the top of my head, but of course we cited those. As far as the cost of transportation, food, I believe healthcare, we also report in our report. Those are summarized by region by Bureau of Labor Statistics, so you can find that as well. And again, that particular information you can find in the body of our report. We have a graphic kind of showing where child care stacks up against that. But as far as food and transportation, healthcare, and we've summarized housing in that table to compare it to child care by region. And one of the interesting things is you'll see that child care rivals the cost of housing, and gosh, off the top of my head, I want to say it was around 30 states plus the District of Columbia. So definitely some information worth diving a little deeper to for your state.
Great, thank you so much, Jess. That was really helpful. So the next question is really around affordability, and I'm going to ask our colleague Dion to respond to this one. Regarding affordability, what is the definition of affordable in this context? Does Child Care Aware of America have a suggested percentage of income that child care costs should not exceed?
Yes. In 2016, the Department of Health and Human Services made a recommendation that child care costs in a household be no more than 7% of the median state income. Anything higher than that is considered unaffordable. So in our report and rankings, we take the state average cost of child care and divide that by the median household income in the state. And that gives us an approximation of what the middle of the road household pays for child care in the state. The affordability recommendation prior to 2016 was 10%, but since 2016 we've been using the 7% of the state median income for that.
Great. Thank you so much, Dion. And please keep your questions coming. Even if we can't answer all of them today, we will definitely respond to all of them and make sure that folks see those responses. So the next question is around legislation for Michelle. What is your sense of any proposed or pending legislation from Congress that is meant to deal with the issue of child care costs?
Great question. Thanks so much again. So without stealing the thunder of our special guest, I do want to put a plug in there for a bill that was introduced by Senator Murray and Representative Bobby Scott of Virginia, the Working Families Act of 2017. And this not only tackles helping the cost for families, but also looks at the workforce and raising wages. So we're going to hear a lot more about that proposed legislation in a little bit, but that's an incredibly important piece of legislation that we want you all to start talking to your members of Congress about endorsing and supporting. And of course, there was also a question about CCDBG. We're always looking for increases to the Child Care and Development Block Grant as states are really grappling with improving quality and also ensuring that children that are from lower income families have access to quality, affordable spaces. So those two pieces of legislation are critical to have conversations about with your policymakers.
Thanks, Michelle. So now we're going to pivot a little bit. I want to talk, there's a question here around children with special needs. So what are the statistics for child care programs for children with special needs over the age of 12? And I'm assuming that we're going to, that the question is around the cost of care for kids with special needs. Dion?
We didn't really look at specifically special needs children in the cost of care, although we are interested in looking at that over the year. We're going to be having a special white paper on special needs education, and we're also very interested in looking at infants and toddlers as well and doing cost of care.
Yeah, and just to add to that, Dion, this is Michelle. We absolutely know that having access for parents that have children with special needs, getting access to quality childcare is an incredible challenge. And we've also explored this topic within our child care deserts research. So knowing that parents that really have a gap in finding quality, affordable childcare is a concern for most families, but especially if you layer in having a child with special needs, making sure that there's an option that really can accommodate that and that parents can access and they can afford is something we really want to dive deeper. So we really appreciate that question, and we really, if you have any special models or programs or in research into that particular area, we'd really like to know as we're looking at doing some more white papers and deep dives.
So as we're thinking about white papers and deep dives, we really appreciate the questions, but also the comments that are coming through. And I'm going to open this one up for the team here. In other words, you talked about quality and the QRIS. We've had several questions around quality and QRIS. I want to raise this one. It said to also, so you talked about quality and the QRIS. It said to also address quality early care learning. That being said, would the STAR rating system play a role in child care costs in certain states?
We do report on our state fact sheets report, which is different from this one. We do report on accredited care, and we do have some costs around accredited care for different types of programming. We don't at the moment have costs around QRS, and that is partly because there's so many different systems around and across the states. One of the things that we are interested in doing, and hopefully we'll be able to do with some of the mapping the gap work that we're doing, is some states are very interested in looking at their QRIS system and looking at the costs as it relates to their QRIS system. And we're hoping to have at least one state where we can really do a deep dive into looking at cost and quality. And it would be a case study, of course, in that one state.
So I see a couple of questions about having trouble locating the map and parent tip sheets in our social media toolkit. So what would be great is that we will go through again, just looking at how do we get to, what are the pages and the links and where is everything located, and we'll do a deeper dive of looking at some of the county level data and the social media toolkit, how you can really take action and get involved in changing the landscape of quality child care.
Yeah, it's a great question because there's so much good stuff on this page that sometimes it's a little hard. I lose track. I get distracted by this beautiful map and then remember that I needed to go find the report. So when you go to the cost of care page, URL. Oh, they can't find a URL.
So it's our URL is usa.childcareaware.org/cost of care. So anytime you visit our page, usachildcareaware.org/cost of care, this page will pop up that you're seeing on your screen for all of the resources that you need. And Jess is going to do a walkthrough of some of the materials.
Is it worth going to the home page and starting? Okay. So even I got distracted by the map. So if we go back to the home page, where I'm sure folks are starting, oh, well, this is fortuitous. So one of the ways you can get there is by accessing this beautiful banner and clicking on Learning More. Got kind of a lot going on our screen right now. So if you click Learn More, that's one way to get to the cost of care map. However, I'm going to go back one more time to the home page. So if you go to Advocacy and Public Policy, that's where you can find, that's one place to find all of our great reports and all of the great stuff going on in our policy area. All the way on the right, you're going to go under Reports and click on Parents and the High Cost of Care. I'm going to give it just a second to load. And that's where we're going to find the High Cost of Child Care page. And on this page, as we walked through briefly before, you're going to see the map. And if you scroll all the way to the bottom, that's where you're going to find the PDF copies where you can access and print out copies of the report, the appendices, the parent tip sheet, and our social media toolkit. If you scroll down just a little bit further, you're going to find our full-page graphic that goes along with this year's data, as well as some customized county-level infographics. And if you're so inclined, you can create your own infographic for your state to share and spread the news about the high cost of care in your own state. So we definitely encourage you to do that. And we encourage you to share those with us and to reach out if you have any questions about any of this information.
And Jess, can you click on one of the states that has the county level data to kind of show what they can find when they double click on their county? What kind of resources are provided there?
Sure. So within the map itself, you'll get access to, and let's look at somebody else this time, look at Arizona. So you're going to double click. to get a county-by-county breakdown of what's going on in that state. So you'll single-click on that county to get just a quick snapshot of the annual cost of child care for an infant in a center. And that's viewing all data. That's where you get a very similar pop-up to what you find for the state, but it's broken down by county. And again, just giving you a quick idea of what that looks like county by county. Once again, you can navigate by county in this little pop-down that we have at the top. And of course, what we're looking at now are just the counties in Arizona. So if you wanted to jump to a county from Minnesota, you'd have to go back out, double-click on Minnesota, and then you can check out different counties in Minnesota. So I'm going to jump out of that and go back to the full map so I can show you guys how to get to those PDFs where you can print out the information by state. Try somebody else. So if we were to look at New York, you go to view all data, you see that pop up. Scroll down to the bottom of that pop up, download this data, takes you to that print-friendly PDF that we have. There's a little bit less color, so it's a little easier on your printer, and it's easier to take with you when you're going out and talking about childcare in your state or in your community. So we'll just go back to the map. And just to reiterate, the state-level PDFs are available for each of the states. We do not have county-level PDFs available. However, in a few weeks, we are going to release our county-level supplemental report to our larger report with some high-level analyses, county by county, on the affordability of child care in those 7 states that we're featuring this year.
Great. Thanks so much, Jess. So we have a couple other questions on how to get involved and take action. So I'm just going to pivot us a little bit to our Action Center, and you can go to childcareworks.org. And that has all of our resources on how to get involved and what you can do at your local community. So right now we're asking for family advocates to join us for our Family Advocacy Summit. And around the actual cost of care report today, you can send a message to your member of Congress. So we'll show you how to do that. So if you go to our Take Action page, and get involved, and the bill that we're going to hear a little bit about when our special guest joins us in a couple of minutes, you can actually click on Take Action and send a letter to support the Child Care for Working Families Act directly to your member of Congress from this page. So this is really a one-stop shop advocacy and action network that really can help you share this. So you're not just sharing about the report, but you're sharing ways on how families, providers can get involved and really amplify the voices out there to support childcare for all families that are struggling. This is just a great way. Another thing that I wanted to point out is on the homepage, we are taking, I mentioned this, we're taking applications right now. So if you know a great family advocate that you want to send to DC in April, who, like Nicole that joined us earlier, Nicole joined us last April, we actually set up training and a program for family advocates to come with us during our 2018 symposium and come with us on the Hill to meet with their member of Congress. So we really give them the training, the tools that they need, and provide a stipend and pay for their expenses to come with us on the Hill to advocate. So that is definitely a call for all of you out there that are either parents, families, part of a family yourself and are struggling with this, or if you know of anyone, or child care providers that want to join us for our National Day of Advocacy, come along. So I think we're going to take one more question at least, and it looks like we'll check in with our Senator Murray's staff to see her ETA. All right, it looks like Senator Murray has joined us. I'm going to hand the reins over to our Executive Director, Lynette Fraga, to introduce her.
So wonderful. So thank you very much, Michelle, again, Jess and Dion, and everyone on the line who are asking so many fantastic questions. Much action, much to take in. I now have the pleasure of welcoming our special guest, Senator Patty Murray of Washington. For over 3 decades, Senator Murray has been a strong advocate for the needs of children and families. She began her career in Washington as an advocate for a local preschool program that was targeted for spending cuts. And thanks to her success, organizing a large coalition of parents, Senator Murray saved the program. Over the last 25 years, Senator Murray has championed critical legislation that supports the education, health, and development of young children. That's why Senator Murray, along with Congressman Bobby Scott of Virginia, sponsored the Child Care for Working Families Act. This legislation would help to ensure low-income families pay no more than 7% of their annual income on child care and help young children gain access to quality early childhood programs. It would also help provide the necessary resources to establish and or expand the child care resource and referral networks, and additionally would support initiatives that help the child care workforce through increased training and compensation and ensure they are paid a living wage and more than double the number of children eligible for assistance under the Child Care Development Block Grant. Senator Murray is the ranking member of both the Senate Health, Education, Labor and Pensions Committee and the Labor, Health, and Human Services Education's Appropriations Subcommittee. Both have oversight of child care issues. We are so pleased to have her join us this afternoon. Welcome, Senator Patty Murray.
Well, hello. Thank you, Lynette. And first of all, I want to thank you all for your tremendous work in fighting for high-quality, affordable early learning and care in your communities and on a national level. And I also want to thank Child Care Aware for releasing their report that highlights the child care crisis we are facing in this country and what steps we should be taking to make sure no family has to pay more than they can afford on high-quality early learning care. As many of you know, I got my start in public service advocating for my own kids' early childhood education back in Washington State. When my kids were very young, our state legislature wanted to shut down their preschool program through budget cuts. So I bundled my kids in the car. I drove 100 miles to Olympia, our state capital, to just explain to these legislators why this preschool program was important and why it was worth saving. But as I was making my case to a state senator, he looked down and said to me, I couldn't make a difference because I was just a mom in tennis shoes. I was mad. I was a mom in tennis shoes, but I knew that that shouldn't stop me from being able to make a difference. And it wasn't easy, just like the work you all do isn't easy, but I called my friends, who called their friends, who called their friends, and after months of showing up at the state legislature and making our voices heard, we were able to convince state legislators this program was worth saving, and they reinstated it. I went on to teach at that preschool, and just like all of you, I understand how important high-quality preschool and childcare is for our youngest learners. When kids don't have access to quality early learning and care programs, it impacts them throughout their lives, and it can have consequences for working families, the middle class, and for our entire economy. The skyrocketing costs of childcare today are forcing some parents to pay more than they make, and others are even being forced to quit their jobs. Everyone on this call knows there are steps we can and need to take to address these critical issues and start building an economy that works for all families. So I was proud to work with all of you and Representative Scott to introduce the Child Care for Working Families Act earlier this year to start investing in our families and our teachers and our youngest generation. Our plan will take on the rising costs of child care by making sure parents don't have to pay more than they can afford for quality care. It will increase access to high-quality preschool programs for low and middle-income families, and it will support our nation's child care workforce with higher pay and better training so they can help themselves and our next generation thrive. Now, shortly after introducing our bill, I had the opportunity to travel around my home state of Washington in coordination with Child Care Aware of Washington to hear from parents and teachers and center directors on the challenges that are unique to their communities and what we can be doing to support their needs. I also saw the importance of making sure parents are informed about their child care options through state and local child care resource and referral agencies. You know, the work you do is so important, but we know it's going to take significantly more resources to build a sustainable child care system that actually works for our families and local communities. I don't have to tell you it's going to be a tough road to get it done, especially as we are seeing so many threats to middle-class families. But if we don't keep talking about these issues and fighting for what we believe in, we're never going to get there. So I am asking you to keep up the good work fighting for children and families at the state and local and federal levels. We've got to hear your voices to move this issue forward and to show that there are parents and teachers and advocates on the ground who believe investing in our next generation is one of the smartest things we can do. So I want you to know I'm going to continue to be a partner and advocate for improvements and investments for child care and early learning programs in Congress. And I so appreciate all of the hard work all of you do. Thank you.
Thank you so very much for your comment, Senator Murray. We are so grateful for you joining us today. We are so grateful for the work that you do on behalf of children and families and the wonderful work that has been done over the years. Your commitment to investing in families, teachers, and our youngest children in the Child Care for Working Families Act 2017, and commitment to a sustainable child care system certainly resonates with us as an organization and many of those that are on the phone today. We could not be more pleased that you were able to join us, share with us about your history of connection to child care and the early childhood community and your current and future work in this area. Again, so grateful that you could join us for your comments to this conversation. We are now going to pivot to additional questions. I think we do have time for a couple of additional questions. And again, so grateful for all of you that are joining us. We do have a couple of questions, I believe, that we're able to field now.
Yes, so we've got one question that is very relevant to what we're talking about. And the question is specifically around whether or not Child Care Aware of America has any plans to research how affordable it is to be a child care provider. In other words, what is the difference in cost of child care of serving as a family child care provider versus center-based care?
So one of the things that we've heard from the field is that some different states are saying that family child care providers may be leaving the field. And so one of the things that we're very interested in thinking about is the cost that it takes to run a family child care center versus a child care center in specific states. Again, we would be looking at specific states and maybe doing some case studies around that work with our mapping. So we're really interested in that. We want to kind of peel the layers of that onion up down to see whether or not there is some issues around family child care providers leaving, and if it's just too unaffordable for them to stay in business, what kind of resources they may need, what's the difference between what's happening in a family child care versus the center-based care. Another thing that we're very interested in is really understanding what it takes to, what the actual costs, including what it's taking for providers to provide care for children. So really partnering with some of our research partners to think about the cost of not just what it costs a parent to pay for care, but what it costs a provider to provide that quality care. So I'm going to turn it back over to Lynette, who is going to take it to close.
Thank you so much, Dion. We are going to move to close. Thank you again, everyone, for joining us today for the launch of our 11th Parents in the High Cost of Child Care report. We did get some requests and some questions about posting the slides. All of the slides from today will be posted later this afternoon, so please visit us on our website. Again, this is just the beginning of the conversation. We look forward to continuing the conversation with you and feel empowered to take action. Get involved by contacting your policymakers and asking them what their plan is for addressing child care in the United States. Please stay engaged. Visit us at usa.childcareaware.org to download the press and social media resources, check out the interactive state map, do what Jess did and run through the entire set of resources that are available digitally and the tip sheets that are also available. To Michelle's point, please visit childcareworks.org to join the movement for quality, affordable childcare for all, and spread the word to your friends and your colleagues and to policymakers about the issues related to childcare. If you have questions on the research, policy recommendations, or anything else after fully reviewing the report, please feel free to reach out to our team. We want to hear from you. Michelle McCready as the Chief of Public Policy, Jay Nichols, our Director of Federal Policy and Governmental Affairs, Dion Dobbins, our Senior Director of Research, and Jess Tersha, our Research Analyst. All of them are at the ready to ensure that we provide the information and supports needed to get the word out about parents and the high cost of childcare. And we want to hear from you not only about this report, but also about future data and questions that you have, so that we can move towards having a sustainable child care system for all children and families. Thank you so much for joining us today, and this is the end to today's webinar.